Hi everyone. So this is second part of the video pathology images. So in the following image we have the axon, and covering the axon is the myelin sheath, which is secreted by the Schwann cells. Schwann cells lying on the outer side, then there is myelin sheath and inside is axon. So in the question we can be asked, in the Guillain-Barré syndrome, which layer is affected? So which layer will be affected? This one, myelin sheath. Then next we have Glisten score. Glisten score is used in prostatic carcinoma. So in the grading of prostatic carcinoma, so Glisten score and Glisten group is there. According to the Glisten score, we grade it. Like if there are well formed glands, then the Gleason will be 3 plus 3 equals to 6, and it is equal to grade 1. And if there are predominantly well formed glands with a lesser component of poorly formed, means some gland are poorly formed, then the Gleason score will be poorly formed accounts for 4. So 3 plus 4 equal to 7, and it will be grade 2. Then if predominantly poorly formed glands are there, purely formed or fused or cribriform glands, then 4 plus 3, 4 is primary and 3 is means lesser amount of well formed glands, equivalent to 7, it will be grade 3. Then if there are only poorly formed or fused or cribriform glands, no well formed glands, so the Gleason score will be 4 plus 4 equals to 8, and the grade will be grade 4. Then Gleason score will be 9 or 10 if it lacks gland formation. No glands are there, neither poorly formed, neither well formed. Only or necrosis is present. Then it will be grade 5. So we need to remember how we score the Gleason score and how we grade. First is well formed glands. Well formed is 3. Then is poorly formed gland is 4. If it is predominant, then 4 will be considered at first, and if it is lesser amount, then 4 will be taken as secondary. Then is only poorly formed, then 4 plus 4 score. And if there is no glands, only necrosis, then it is 10, 9 or 10 score, and it is equivalent to grade 5. We need to repeat it 2 to 3 times, then we will easily remember it. Then the next image is showing the type 2 pneumocyte. Type 2 pneumocyte are present in the lung tissue and it are responsible for surfactant secretion. In the type 2 pneumocyte, we can be asked, what is this structure? This blackish structure is lamellar body. Lamellar body are the structures where the surfactant is stored. Then the next image is of kidney tissue, and here it is showing the clear cells. So it is clear cell RCC, clear cell renal carcinoma, and it is due to 3p deletion, due to the deletion in the p arm of the third chromosome, and the cell of origin are proximal convoluted tubule PCT, and it is sporadic in nature. So we need to remember the p's. It is 3p and PCT. Then this is image of Hodgkin lymphoma. Hodgkin lymphoma is CD15 and 30 positive. Need to remember the markers 15 and 30 positive. And there are classical cells that are called Reed-Steinberg cells, which are demonstrated here. Reed-Steinberg cell is having owl-eye nuclei. This is image of nutmeg liver. Nutmeg liver, basically the question will be like this, that which is the pale segment and which is the viable segment, which is dead segment and which is viable. So dark appearing zone, dark appearing means reddish appearing zone, we will consider that if it is red it is live, but no, in this case the dark appearing zone is dead and the pale yellowish part is viable. Then this is the agarose gel electrophoresis of DNA extracted from the culture cells. In this image, we are differentiating between the apoptosis and necrosis. During the electrophoresis, if the ladder pattern is present, then it is apoptosis. And if it is diffuse smearing of the DNA, then it is necrosis. Viable cells will be like this. Then in the apoptosis, there will be multiples of oligonucleosomes, ladder pattern. And diffuse smearing will be there in cell necrosis. This is image of acute rheumatic fever. In the acute rheumatic fever, fibrin vegetation along the lines of closure, varicose endocarditis will be present. Here, the fibrin vegetation are present along the lines of closure of the cusp of the